Forget the tedious wait in the holding room and forget being crammed next to sick people as you wait for your doctor. Australia is now one step closer to achieving widespread virtual medical treatment by their doctors, following a boost by the government to trial new telehealth technologies. The Department of Health and Ageing has allocated $20.3 million to trial 9 different telehealth technologies in line with the rollout of the high-capacity national broadband network in Australia. Currently, a big slice of Australia's economy is being spent on healthcare. Dr Sarah Dods, the leader of health services for CSIRO's digital productivity and service Flagship, said that Australia is currently spending 20 cents in every dollar on health, and the figure is forecasted to double by 2043. Telehealth technologies aim to reduce the burden of care for chronic, ageing and remote patients by reducing the cost of travel and improving specialists' ability to identify a range of conditions for all Australians irrespective of their location. 2 of the 9 government-funded telehealth projects include CSIRO's home monitoring of chronic disease for aged care and NBN-Enabled Indigenous tele-eye care. The home monitoring system will allow nurses to support chronically ill and elderly patients via use of in-home monitoring. Australia's ageing population is swiftly growing. According to the ABS, there was 2.4 million people aged 65 to 84 years of age in 2007. This figure has and will continue to grow by 3.5% for the next 11 years until the demographic will be 4 million strong in 2022. Dr Dods said telehealth technology will help relieve the financial burden on Australians' healthcare system, with chronic disease sufferers and the elderly accounting 70% of Australia's $103.6 billion health expenditure between 2007 and 2008. The technology looks to improve many facets of a patient's life, particularly maintaining their independence and comfort of living while reducing the financial burdens to the economy, Dr Dods said.
Chronic diseases are long-term, non-contagious conditions, such as diabetes and heart disease, and they tend to turn up more as we get older. People with these kind of conditions tend to have things go wrong on occasion and end up in hospital more often than the rest of us. This trial is about telehealth providing remotely supervised home monitoring to help these people manage their conditions better at home and to stay well.
CSIRO's home monitoring trial will deploy in-home services for 150 patients over 6 different sites, including health facilities in Ballarat, Townsville and Greater Western Sydney. Virtual treatment options will arguably have the greatest impact on Australians living in regional and rural areas. Dr Dods said that currently, regional and rural Australians' access to healthcare professionals is limited, which often leads to poor medical outcomes.
People who live in rural and regional Australia have higher hospitalisation rates and worse health outcomes, and that's just from difficulty in being able to access health services. National broadband is being rolled out across Australia, and that is an opportunity to think creatively about how new kinds of telehealth services can address these growing needs.
In support of regional and rural Australians, CSIRO will launch an early intervention service which will allow specialists in metropolitan hospitals to identify eye diseases via video conferencing in remote Western Australia and the Torres Strait communities. The NBN-enabled technology, Remote Eye, will provide remote delivery of specialist eye care to Indigenous and older Australians in rural areas. The Australian Bureau of Statistics report into health and welfare of Australia's Aboriginal and Torres Strait Islander people told that the burden of disease suffered by Aboriginal and Torres Strait Islanders are estimated to be 2.5 times greater than the burden of disease in the total of the Australian population. Diabetes, one of Australia's worst chronic diseases, can lead to problems with vision. Dr Dods said virtual conferencing will help to identify and treat these conditions.
There are a number of eye diseases around that can actually leave you blind if not diagnosed and treated. One of these is complications from diabetes, or sugar as it's known in Indigenous circles. We know that it's higher in those communities. This trial is about using medical staff to collect all the information that the ophthalmologist needs. The ophthalmologist can then join in by video and can provide the same kind of consultation as they would if the patient was in their office.
Dr Dods hopes the low-cost eye screening technology will eventually be offered to chronic patients in the home and at local schools.
Local residents are likely to see eye checkups offered routinely at their community health centre and less need to travel to receive specialist eye care. Eventually, we'd like to see routine eye screening available in remote and regional schools. For people who have a chronic disease, you're more likely to have an option through your local health service of a home monitoring system that would provide better ongoing support in monitoring how the disease is affecting you on a day-to-day basis.
Currently, options are already being offered by medical practitioners across the country. Sophie Benjamin lives in regional Queensland. She wrote about her experiences with telehealth on Panorama's Facebook page earlier today.
I had regular Skype appointments with my Brisbane-based psychiatrist when I moved to regional Queensland. It was fantastic and saved me a lot of money in flights, accommodation, and time off work. That said, I'd already built up a relationship with him in the 9 months before I left. I don't know if remotely Skyping a psych would work too well for people in regional areas who have only just started seeking help.
Both CSIRO's telehealth trials will run for 12 months, and while focusing on clinical outcomes, they hope to investigate the technical requirements of these services over different broadband providers. The trial will involve more than 1,300 patients in rural health clinics, hospitals, local health districts, nursing homes, and patients in their own homes across Australia.